With COVID vaccine mandates, booster shots, and new variants, there is a lot of new information to sift through. ABC News Chief Medical Correspondent Dr. Ashton joins us now to help us navigate through some of this information. Welcome.
Thanks for having me.
So, as you know, a new variant named R1 has been detected here in California. For one, it's believed to be less susceptible to the vaccines. How long before a variant that is no longer vulnerable at all pops up? And if that happens, what happens next? I mean, could there be a whole new pandemic?
Well, no one knows the answer to that question. I think the big picture points here are that we have to remember viruses mutate for a living, so people should not be surprised, nor should they be frightened necessarily when they hear about a new variant or new strain. This is why we have genetic sequencing. This is why we have plenty of people at the state and federal levels checking the genetic fingerprints of a lot of the specimens that we're collecting here in this country and communicating with other countries around the world so that we can evaluate and assess these new variants as they come up. Right now, R1 is neither a variant of interest nor a variant of concern. 99% of the virus that's circulating in the United States is the Delta variant. But the big picture, the bigger picture that you alluded to in your question is that as long as there are parts of the world where the virus is replicating, where people are not vaccinated, we will continue to see variants. And yes, you're 100% correct that the concern is that we will one day come face to face with a variant that our vaccines do not offer decent protection against. And that's why there's this race, vaccine against the virus.
Meanwhile, let's talk booster shots. Should people getting those be concerned they might have had COVID and not known it, considering some doctors are saying to wait 90 days after a breakthrough case before getting a booster shot?
No, so let me clarify that because there is a lot of misinformation, especially or unfortunately even given by healthcare providers here. The CDC and the FDA are clear. They are saying if people have been naturally infected with COVID-19, which means either they have been infected, they tested positive if they were unvaccinated, or they had a breakthrough case, but more to the unvaccinated part, they can wait 90 days before getting their initial dose of the vaccine. When it comes to boosters, you know, people are saying that's kind of its own category. I think we need to be prepared and expect that there will be more of these so-called breakthrough cases. But the best data really shows us that the best protection, the best antibody levels, which is just one part of our immune defense against this virus, comes in people who were naturally infected and then were vaccinated subsequently. So it's not either or, it's both.
That's good to know. The pandemic has ravaged people's mental health. As you know, this is Suicide Prevention and Awareness Month, and I know this topic is personal for you. Do you have any advice for people?
Well, thanks for bringing it up. I think that the advice would be that everyone needs to consider themselves and the people around them at risk for mental illness, whether it's temporary as a result of the pandemic or whether it's something that they've been struggling with for a long time. My children lost their father to suicide 4 years ago. My ex-husband, he was a physician as well. And so we wrote about our story in Life After Suicide and the story of other suicide survivors to help those people left behind and to help increase awareness, to let people know that as hopeless and helpless as they may feel, they're not alone. Things will get better. There's always hope and help. And just as we teach children 911 to call if they see an emergency, I think we all need to familiarize ourselves with the 1-800-273-TALK, the suicide prevention lifeline number.
ABC News Chief Medical Correspondent Dr. Ashton, thank you so much for sharing your time with us.
Thanks for having me. I appreciate it.